Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, and welcome to this episode of this AMA Steps Forward podcast series. This is your host, Dr. C. Chen, Physician Director of Practice Sustainability here at the AMA. We will be discussing some fundamental topics in information technology as it pertains to healthcare. I'm pleased to be joined by our guest, Dr. Margaret Lozovatsky, our Vice President of Digital Health Innovations here at the AMA. Thank you so much for being here with us today.
Thank you for having me.
Before we get started, would you mind telling our listeners a little bit about yourself and your background?
Yes, absolutely. So my name is Margaret Lozovatsky. I am a general pediatrician. I practice as a pediatric hospitalist and still see patients a few times a month. And I am the VP of Digital Health Innovations at the American Medical Association. A lot of people ask me what that means. I have a background in clinical informatics, so I'm double boarded in pediatrics and clinical informatics. And before I joined the AMA, I spent a lot of time in various CMIO, CHIO roles where I had responsibility for setting strategy of how technology is used in our healthcare settings. And so at the AMA, I lead a team that focuses on how we can support our physicians in the use of technology in all healthcare settings. So both in ambulatory inpatient ED, but also in less traditional modalities in digital health environments.
Thanks for that background. I know you mentioned a couple of different acronyms, and I know we use a lot of acronyms at the AMA, but in healthcare in general, could you sort of tell our listeners some of those informatics-based acronyms like CMIO, CHIO? What do those mean?
Great question. So CMIO stands for Chief Medical Information Officer, and CHIO stands for Chief Health Informatics Officer. And those are usually physicians that have a background both in medicine, of course, because they're physicians, but also in understanding technology and how to bring technology to the healthcare environment. And that role has really evolved over the years. When I started, you would have CMIOs often responsible for implementing EHRs. That was the era of bringing technology into healthcare. I like to describe them as the folks that would walk around and help you figure out which buttons to push. They were usually the techie physicians that were interested in technology. As the role has evolved, it really has truly become a leadership role where it goes much beyond at the elbow support. And now CMIOs often have a seat at the executive table where they are really looking at best practices for how to bring these technologies to healthcare. They're looking at the strategy of which technologies should be implemented, and often have teams that are working across the institution to do the support role that I described earlier.
Well, thanks for that introduction into sort of the informatics world. Dr. Lozovatsky, I know we've had this conversation quite a few times, but when I think of, hey, I'm having problems with my password and trying to log in, I call IT, the IT help desk. But you've mentioned informatics and informaticists. What's the difference between the information technology or IT department and medical informaticists?
Yeah, that's a great question, and one that I think is confusing to everybody. So the way that I like to describe it is that the IT department is responsible for the actual technology. So as you mentioned, when your password doesn't work, I would call the help desk and they'll help you reset it. That is their job. If there is a keyboard that doesn't work or a mouse that doesn't work, once again, that is the IT department. For any issues that touch the patients or the clinicians where it involves any sort of medical knowledge, that's where it's really critical to engage the clinical informaticists. And it's not to say that the IT department is not engaged, but the clinical informaticists really function as liaisons between the IT teams and the clinicians. And it's an important role because we're sort of like interpreters. When you call the help desk and you say that I have a template that needs a lot of things added because let's say you are a nephrologist and you have specific things that you need, the way that they interpret it is they will do exactly what you say. They might add all of those fields. The reason it's important to involve the clinical informaticist is that that individual will actually look at the way that you document and really think through all of the different fields that exist already in the system. And they'll help the IT team build it in a way that makes the most sense so that that data is stored in the right places in the EHR so that you can use it again when the next person sees the patient. And that's a simple example of the role of the informaticist. When you think about more broad changes in our clinical technologies, you often have physicians that know their clinical environment and they may have a request of a technology that will be helpful to them. It's really important to have the informaticist in the conversation because that technology may not solve the problem you're trying to solve. And so the informaticist can really work through that with you, get to the root of the problem, and build the technology in a way that will be most useful to you.
I think that's super helpful. It's really good to know that in a lot of organizations, there are physicians dedicated to sort of translating what we need in the clinical setting and sort of working with those technology folks in IT. So I think our listeners would benefit from understanding this and then sort of going to the right person. So thank you so much for that. Changing gears a little bit, in terms of healthcare organizations, there are a lot of technology systems, obviously, that are sort of ubiquitous in what we do. But what are the main ones that you think that physicians should be aware of? Not just obviously the EHR, but what other things in the clinical setting, but also administratively? Are there systems that are more or less important in your purview, or are they all sort of necessary?
I think it's important for us to be aware of the systems that are integrated into our environment. And I say that recognizing that we're busy caring for patients. And so it's hard sometimes to take a pause and really think about the technologies we're using. And at the end of the day, we just want the technologies to work. We want them to function seamlessly. And it's important for us to have a role in that. And so I would say, of course, the EHR is what we see the most. That is the system we interact with the most. What many folks don't realize is that in complicated health system environment, there is 400 or 500 systems that are integrated into the EHR. And they range from radiology to pharmacy systems that are all part of the way that we receive clinical information. And sometimes the way that those integrations are done really impacts our day to day. So, as an example, when I was in my CMIO role, we went through a change in our radiology systems. And so, from a clinician perspective, when I was opening the radiology study result, they were taking longer to open. And for me, on a day to day basis, it's just a frustration. But understanding the why that was happening, understanding that that integration that was designed in a way that was less optimal for me needed some adjustments is really important. And it doesn't mean that everyone needs to be an informaticist to understand that, but it does mean that we can all help speak the language when we are interacting with both the informatics team and the IT team to be able to communicate the challenges that we're experiencing. It's also important to understand some of the HR systems because we deal with them, of course, as an employee, but we also deal with them in the clinical settings because often they drive the tools that we have based on the roles that are assigned to us. So again, doesn't mean that every physician needs to know every detail of how that works, but understanding the basics of the fact that these systems exist is important. And I'll also add that I think it's really important for us as clinicians, in order to be able to communicate what our needs are, to just understand the basics of how these systems are set up. So I'm a pediatrician. My needs are different than a cardiologist. They're different than a nephrologist. And so when I am trying to see my pediatric patients, understanding the basics of some of the tools that are involved in their care is going to allow me to have a better conversation with the technology teams so that I can communicate what I need. Like we do weight-based dosing, and the weight-based dosing relies on having the weight accessible in the chart. So some of those basic principles that I can communicate more easily if I understand how the systems are gathering some of this data.
I think that's really important to point out that we don't have to be all experts in everything informatics and information technology. It's that we need to know, or at least be aware of what's out there so that we can actually ask the right questions. So I think that that's really important. And I'm glad you highlighted that. In terms of the electronic health record, and I think we use EMR, EHR interchangeably these days. But I'm sure if you can tell me, if there's a difference or without a distinction or with a distinction, is there a distinction, number one? And I know that when we've sort of rolled out EMRs, EHRs, we thought it would be a great thing. You and I know we both went through this, when we went from paper to electronic medical records, that, hey, it's going to solve everything. We don't have to go and grab vitals for each patient and write them down on a little slip of paper. We could have it at our fingertips. But as we know, 10, 15 years on now, that there have been many unintended consequences as well as successes. So how do you think practicing physicians, number one, should approach the adoption of these new technologies and contribute to their input? But first, the EMR versus EHR question first.
That's a great question. So similar to the CMIO versus CHIO, I use the terms somewhat interchangeably, but I think if you want to be precise, the medical part typically references physicians, and we know that EHRs are much more broad than that. So I typically use the term EHR to really incorporate all of our clinicians that are using these systems and center it for the patient record.
Thank you. And then getting back to the unintended consequences, all these shiny new toys that we have, what should we be on the lookout for in terms of adopting the latest and greatest technologies? And how do you think physicians can contribute their input to the process?
Yeah, these are all fantastic questions. And I think we're all still learning from the way that the technologies have been rolled out and some of the best practices that are starting to surface. And the way that I really think about this is that initially, when the goal was to digitize health records, the projects, if you will, the implementations were often led by technologists because they were the experts in technology. And we, as busy physicians, didn't always have the time to invest in understanding the how and the why and understanding the design of what was being developed. And we also, all of us, both the technologists and the physicians, didn't necessarily recognize the fact that the way that information is stored in a computer system is very different than it was on paper. And so with all the best intentions, many of us said, we have this paper form, we want it in the computer. And many of us were pretty insistent on that. And so part of the challenge is that we took paper and we put it into a computer. And much like you don't take a web page and put it in an iPhone, that may not have been the best approach. And I think we all take responsibility for the fact that that's what happened. And so some of the design was not optimal. And we talk a lot about human-centered design and the fact that many of our websites and our apps are now designed with much more sophistication. And there is a lot of work to be done to make those changes in our electronic medical records and in all of the technologies that we use. And yet we know technology has a lot of potential because you highlighted the fact that we no longer have to run around to get vitals. And, last week I did a shift and I had a patient come from another state that was a refugee, didn't speak any English. And within minutes, I was able to get the record and get all of the information. And those are experiences we didn't have before. And we didn't have this at our fingertips. But with having all of that data at our fingertips, the complexity of interpreting that information is a new challenge that we're all experiencing and we may not have recognized would be a challenge. The amount of information that is available on a patient these days is hundreds, thousands of times greater than what we had in the past. And so we are now at a place where we are encountering, as you highlighted, different challenges. And there's a lot of really cool tech. And everyone's asking the question of how do we ease some of the cognitive burden that we're experiencing today that is largely because of all this information that's coming at us. And what I would say for the physicians out there that are listening, there are a few things that are important for us to keep in mind. Number one is that there are experts in this field, clinical informaticists, technology teams, that we need to partner with. And we need to be very thoughtful about communicating our requirements for our clinical care that we're providing. And that's what our role is as physicians. And the role of the clinical informaticist is to take that and help us design the best way to use the technologies. And the other thing that I think is really important for us to consider is that the technology is out there and has a lot of potential. And yet it's much more about the people and the process and how we use that technology and how we apply it to clinical care, that sometimes we need to take a bit of a pause and really take the time to do the design work before implementing these tools, because that will pay dividends in the end.
Thank you for highlighting that. I think, there are a lot of new technologies that are out there that are very exciting, but I think you've highlighted this in our conversations in the past that it's really, really important that they actually serve to alleviate a problem instead of looking for a problem to solve. So I think you've highlighted that really well. So another problem that we've been having in the last few years, probably more than that, but there are a lot more in the news these days. Breaches and hacks in healthcare, that's sort of led to a heightened awareness of cybersecurity. I know that most of the times, most of us will have, yearly trainings or something like that to figure out how to do to protect health information, things like not sharing passwords or like storing PHI on unprotected devices using strong passwords. Are there any other basic principles that you can share with our listeners who are physicians and physician leaders that they should understand about cybersecurity and some basics about what they should implement?
Yeah, absolutely. And this is a topic that comes up a lot. And again, I think when we as practicing physicians get busy, it's easy to sometimes try to use a quicker communication route without thinking about PHI. So, probably the top thing that I see that puts us at risk is texting. That is something that is easy to do, but it's really important to remember what constitutes as PHI. So even a description of a patient without putting their name down or putting a room number down into a text is a breach of PHI and can be a significant breach within your organization. I also often highlight that we as physicians have a significant responsibility to keep our patient information private and often are the targets of some of these phishing attacks. So being very vigilant about emails you receive, texts you receive, sometimes even to your private phone that are looking for information and will sometimes look very legitimate and look like you just need to confirm something, but yet you're potentially giving your information away. It's just important to stay vigilant in any environment, even if you're not in a patient care environment, because often we have access to PHI on our phones. I have my EHR on my cell phone. And so I know that I have to be extra vigilant with any communication. You mentioned making sure that you have a secure password. I know that was a huge source of frustration for folks when we are using those passwords to log in to our EHRs, for example, and sometimes you're doing that many, many times a day. But organizations have been very thoughtful, again, working with clinical informatics to design workflows that allow us to use biometrics, for example, that make it a little bit easier and yet still keep our information secure. So that's the other advice I would give folks is if you are encountering some of these frustrations. As an example, when I was a CHIO, that was the era when we were going to the 15, 16 character passphrases. Many of my colleagues did not turn on some of the options that we had. And so they were typing on their phone the 16 character passphrase 30, 40 times in an hour. And of course, that's very frustrating. And so we worked together to use biometrics to ease the burden. And that's really the magic of having some of these clinicians in these roles, because you can partner to help keep everything protected and yet help ease the burdens of our day-to-day struggles with making sure that while everything is secure, it fits into our workflows.
Right. I think clinical informaticists, being physicians, can feel our pain. So I think that they're probably more likely to be try to work with us to help us through our daily grinds, if you will. So absolutely. I would be remiss if I didn't ask a question about AI, given all the buzz that there is. So how do you see AI or any other new technology for that matter fitting into or influencing the practice of medicine in the near future, and let's say the next year or two?
Yeah, of course, AI has been top of mind for all of us the last few years. I always remind folks that while generative AI really became widely used in the last 2 years, AI has been implemented in the clinical settings for many, many years prior to that in things like predictive models and has been part of our daily lives for a long time. And so I see these tools being integrated into healthcare as they are into many other aspects of our lives. And there are a few things that we need to think about as that happens. The first is that technology is moving forward and we need to stay on top of that. So, again, it doesn't mean that you have to be an AI expert, but it does mean that we need to understand how AI functions and understand the tools that are part of our environment. So much like when predictive models, like a sepsis prediction model or a deterioration prediction model, was put into our EHRs, we had to understand what those numbers meant and how to evaluate them when it came to patient care. As generative AI tools are getting integrated into our environments, it's going to be important for us as practicing physicians to understand how to use the tools and what some of the risks are. So, understanding things like hallucinations potentially is going to be important. And from a system perspective, it's going to be really important for us to have structures in place to thoroughly test these tools, to make sure they're functioning as expected, to think about health equity and make sure that these tools are trained with patient populations appropriately in our environment so that we are getting outputs that are equitable. It's going to be important to make sure that clinicians are at the table. And so, what that means to me from a big picture perspective is a few things. First of all, it's going to mean that we as clinicians will need to be engaged in the conversation, in the design of how these tools work. Because if we want them to function for us and to help truly be enablers to patient care, it's going to be important for us to understand them and to help design them. And I also think that there's a huge potential of these tools because, as we talked about, the amount of data that is coming at us is exponentially growing. And what these AI tools can do is they can turn this data into useful information. And that is really exciting to me because I think that we're at a point where no human brain can process all of the pieces of data that are in our clinical environments. And yet the computer has the power to do that. And the AI tools can be tailored to our specialty, to our individual needs, to help present information to us in the right time at the right place. So when I walk into a hospital and I am taking care of 20 kids at the same time, I envision a situation where these tools will be able to process some of that background information and, for example, warn me if a child is deteriorating and help me find the lab results on the most critical labs and triage some of that information so that I can then use that information to make clinical decisions. And finally, I want to make sure I mention that we at the AMA really think about these tools a lot. And we talk about the concept of augmented intelligence when we think about AI, because we recognize that these are tools that are almost like a co-pilot to a physician. And our clinical judgment, clinical decision making is at the center of all of this and is going to continue to be a critical part of practicing medicine. And yet we think that these tools can augment that and allow us to practice at the top of our license.
Awesome. Any other pearls of wisdom that you'd like to share with our listeners today before we close out?
So I'll just say that I think that technology has changed a lot, even in the years that I've been practicing, and you and I have talked about that a lot. And often in our busy days, it can be a thorn in our side because we just want it to work well for us. And so it's important to recognize how far we've come, how much technology has helped bring information to us, and that we as clinicians have a critical role in helping to continue to improve the way that technology works for us. And that gives me a lot of enthusiasm for the future.
Well, it's been a great talking to you today. And thank you so much, Dr. Lozovatsky, for being on today's podcast. It was a great conversation, and I'm sure we'll have more conversations in the future.
Well, thank you for having me. It's lovely to talk to you, Dr. Chen.
Dr. Margaret Lozovatsky, our Vice President of Digital Health Innovations here at the AMA, has been our guest today. Check out the episode description to explore the resources mentioned in today's episode, and until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.